Hello, good evening, everybody. I'm Sayukta from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear mask when in public places. A urinary tract infection, UTI, is an infection in any part of the urinary system, your kidneys, ureters, bladder, urethra. Most infections involve the lower urinary tract, the bladder, and the urethra. UTI is a common problem that affects the quality of life. Let's unite to raise awareness about UTI and its impact. To throw more light on the subject and guide us on what's right for diagnosis and treatment of UTI, today we have with us Dr. Suresh Singh. Dr. Suresh Singh is a consultant urologist and andrologist, MS, MCH, urology and renal transplant, Zipmer Puducherry, practicing at Sambhav Stone and Laser Clinic, Raipur. Dr. Suresh Singh has 10 years of wide experience in the field and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very good evening to you, Dr. Singh.
Hi, very good evening to you and all the listeners. Thank you.
Dr. Singh will start with the very basic definition, or how would you like to, tell our viewers what UTI or urinary tract infection is?
Yeah, to begin with, urinary tract infection is a very common disorder, urinary problem, and it is seen across all ages and both genders. Basically, whenever a person is having any sort of problem in passing urine, like burning, straining, or hesitancy, or multiple desires of passing urine, sense of incomplete evacuation, they all fall in the domain of urinary tract infection. The causes are different in different age groups, and first and basic requirement of treating UTI is proper clinical history to find the cause of it and treat it accordingly.
Okay, so now we know what UTI or urinary tract infection is. Doctor, as you said, the cause may differ and it's common in both the genders, men or women. Now, my question is that are there any group of people who are more at risk for UTI, urinary tract infection?
Yeah, yeah. The subgroup of people who are more at risk of recurrent urinary tract infection are people who have these thing enlarged prostate gland is there, or
Okay.
somebody who has undergone a spinal cord surgery, people having neurogenic bladder due to stroke, or any problem which causes detrusor dysfunction, that is the inefficient bladder emptying. Patients with stricture urethra having narrowing of passage or urethral passage stricture due to iatrogenic cause or due to trauma. So these people are at risk, and patients having recurrent stone, bladder stones, kidney infections, diabetics, immunocompromised patients. So these patient group of patients are at risk of having recurrent UTIs.
Okay. Now, how can a person tell that he or she is having an UTI? I mean, can we tell by ourselves that, okay, we are having this problem, maybe this is UTI, and we should just go and contact and consult a urologist?
Yeah, any individual who is facing problems like burning urination, dysuria, which we call in medical terms, or he has increased frequency. Many times he has to get up from the bed in the night or daytime every 10 minutes, 15 minutes. He has a strong urge to void, but there is very little urine when he goes to loo.
Mhm.
So, and if he's having burning sensation, fever is there, lower abdominal portion pain is there. So these are the clues which can help us in diagnosing an individual that he might be suffering from urinary tract infection, and he must see nearby urologist.
Okay. And as you have already stated, that irrespective of gender, all of us are at risk for UTIs. I mean, there are definitely some groups who are more at risk for UTI, but it can occur in both men and women. Now, do women get urinary tract infections more often than men?
Yeah, very true. As you have said, the women are more predisposed for urinary tract infection. The basic reason is that the anatomy of female genital tract is such that the urethra is shorter, and the bacteria have an easy access from outside to the bladder. So females have a greater propensity of getting UTI.
Okay. And how is UTI diagnosed? When we say diagnosed, we mean that, proper diagnosis of UTI. So how is UTI diagnosed?
See, for diagnosis of UTI, as I earlier said, the basic is the proper clinical examination and history. Second is that we can get urine routine and microscopy. If say the number of bacteria per high power field is more than 5, so we can get an estimate or clue that the patient might be suffering from urinary tract infection. Normally, when you see a patient of UTI, the urine RM shows the bacteria ranging from say 5 to 100 or more than that per high power field. Less than 5 is normal, but when it increases to 5 to say 50 to 100, then it is quite abnormal. So as we say, as we see that foremost thing to diagnose is urine RM examination. Then we can get the ultrasound examination, which may show us bladder stone, enlarged prostate, moving echoes in the bladder, fat standing around the kidneys, thickened urinary bladder. These are all suggestive of UTI. Suppose a large amount of urine is remaining in the bladder after passing urine, that we say post-void residual volume is more, then that patient also is having a very high risk of getting with the UTI infection.
Okay. Now, whatever symptoms you have told us regarding UTI, those are, quite common, and people normally tend to ignore them. Like if they are having irritation while urinating, or they have the urge to urinate quite often, but when they go to the loo, they hardly pass any urine. So these people have this mentality to ignore these things. Maybe, it's summer, so maybe, we are not taking enough water, etc., etc., as all the logics that they will go rather than going to the doctor. When is the right time to see a doctor?
Yeah, very good question. As we say that prevention is better than cure. So whenever an individual faces this problem of burning sensation, the first and foremost symptom of a UTI is sense of burning while passing urine. So that individual should be alerted. And if he develops his burning is not subsided by taking plenty of fluids or by other measures like dietary modification, he should seek an urgent appointment with the urologist and should look to treat the disease. As you said, people tend to ignore the problem. Initially, they try some home remedies, herbal medicines, Ayurvedic medicines, and things like that, which could be very detrimental and cause permanent damage to the urinary system. So, as I have said, that a need program like this, awareness creation is very important. Whenever an individual is having burning urination, which is not getting subsided in a matter of few days, he is having fever. There are risk factors like diabetes, immunocompromise is there, stones are there, or any problem which he thinks that it's difficult to get on its own cure. He should not rely on the home remedies and seek the expert opinion of nearby urologist.
Okay, right. So it's better not to ignore the issue. Please go and consult a urologist as soon as possible if you see any of these symptoms. Doctor, I would also like to know, you just said that prevention is always better than cure.
Yeah.
Now, to prevent UTI, I don't want to have UTI in my life. What can I do? We'll try to connect with the doctor and try to know the other, things about like prevention of UTI and what are the treatments that are available for treating UTI, which is urinary tract infection. Many a times people go and say that they are having fever and they don't know what's the reason behind it. Many a times it comes across that it may be due to the UTI. So we have all
Sorry,
these
I'm really
questions.
sorry. I'm really sorry for some technical glitch.
That happens all the time. It's okay, doctor. So I wanted to know the way to prevent UTI. All the things I can do to prevent UTI.
The take-home message of this conversation is that Prevention is always important than cure. And even for normal healthy individuals, they should take a ample supple supply of fluids, that is clear water. At least 4 liters of water should be there. 4 liters of water should daily intake in 24 hours. He should take citric acid foods like lemon, cranberry, things like that.
Mhm.
And if the person is doing some physical work, like he is a person who is involved in field activities in summer season, he should increase the dietary intake accordingly. And he should avoid foods which have say junk foods or which causes constipation. So that, and if person is a diabetic, he should keep his sugars under control. And whenever he feels that there is a smell in urine, frothy urine is there, less amount is coming, burning is there, he should pay urgent attention and meet the urologist. So the most important foremost part of prevention of UTI is plenty of water, that is 4 liters per day should be the intake of an average healthy individual.
Okay, so the mantra is to have at least 4 liters of water every day of fluid, and keep yourself fit and try to do everything to prevent UTI. But just in case if you have UTI, please go and consult your urologist. That's very, very, very important. Do not ignore your whatever symptoms you are having.
Yeah,
Now,
yeah.
doctor, yes. I would also like to know about all the treatments that are available for UTI.
Yeah, if person is not suffering from any permanent anatomical disorder, say urethral stricture or a spinal cord injury, then simple medication antibiotic treatment is most of the time sufficient. Basically, we have to deal with the root cause. What is causing UTI? Suppose if patient is having enlarged prostate, and that is resulting in high post-void residual volume, that plenty of urine remains always in the bladder. So we need to take care of the prostate problem either by medication or by surgery. Suppose secondly, coming to the point that he is having uncontrolled diabetes mellitus, he should seek to the physician or diabetologist to take care of the in raised sugars. Person is having neurogenic bladder, he should attend to the physiotherapy and do clean intermittent catheterization, so there is no urinary stasis. So most of the time, if there is no predisposing factor except for this low intake of water, the UTI gets treated by this thing, plenty of water and doing behavioral practices. For patients, suppose female patients who are sexually active, they need to do some preventive measures that maintain the local hygiene. They should pass urine after contact, drink plenty of water, and most important is maintaining local hygiene, both for equally important for both genders. But since, as I earlier told you, that females are more predisposed due to the anatomy, they should be more this thing precautious, and we should not hold our due to occupational assignments or this thing. Sometimes it's not possible to pass the urine even if the person is having the urge to do. So we should try not to hold the urine and suppress the desire of this thing passing urine. That is also very important.
Right. So women, be more careful and take a good care of your hygiene, as you're more prone to UTI as compared to men. But
Very
it's
true.
for everyone. Just keep good care of yourself. Take a lot of water and keep yourself hydrated. And don't hold your, don't just keep your bladder empty. Don't hold your urination urge. We have some viewers, doctor. I'll pick Rekha Rai's question. Her question is, what are the risk factors for recurrent UTI?
Yeah. The risk factors for recurrent UTI is that the basic problem which is causing UTI is not treated. Like somebody has to use public toilets which are not very well maintained, or cleanliness is not there. That maybe is the cause for UTI, recurrent UTI. And predisposing factors like say a person is using contraceptive as diaphragms, or not able to maintain the local hygiene due to some factors. They Somebody is suffering from leukorrhea, white discharge, too much white discharge is there.
Yes.
Uncontrolled sugar size, as I earlier told,
Mm.
and taking less water. patient is having plenty of fluid, well, that like people who are involved in say sports activities or sales activities. So things like that. These are the causes of most recurrent UTI. And if the patient is also having bladder stones, stones of any kind, then that could also be the cause of recurrent UTI.
Right. And if a person is suffering from any renal, disorder, maybe a abscess or anything, then also he is at risk.
Yeah. Very much. If patient is having pyonephrosis due to any cause, pyelonephritis, so the normally the patient who is having ascending UTI, the bacteria first involve the bladder. If it is not treated, it slowly ascends via to kidneys via the ureters. That can cause, as you said, pyelonephritis and later on pyonephrosis. That is renal abscess or pus in the kidney. So that is needs urgent medical attention, maybe hospitalization, intravenous antibiotics. Yeah.
Okay. We have Asha Thakur. Her question is, what is the treatment for urinary inconvenience in older patients?
I think it's urinary incontinence.
Urinary incontinence, right?
Yeah. Incontinence means that patient is not able to hold the urine. There is involuntary passage of urine in the bed. So again, there are multifactorial causes of it. The most common is enlarged prostate. The other common cause is neurogenic bladder. If the patient is having, patient is a or so has suffered stroke and there is paralysis, there is no power below the waist. So these patients have full bladder and they pass urine slowly in the bed or in the diapers. So we have to treat the basic cause. If there is enlarged prostate, we should seek the urologist help, take some medicines, or if it is not controlled by medicines, then go for surgery. There are many modern surgeries in which there is no incision, all endoscopy work is done. If he is having neurogenic bladder, then accordingly it should be treated. If it is treatable cause, then he should undergo that surgery. If it is suppose some like stroke patient is there, paralysis and permanent weakness is there, that cannot be treated. So they have preventive measures like clean intermittent catheterization or indwelling catheter. Patient needs to be on catheter all the time or with regular change, say 2 to 3 weeks. Or if patient dexterity is there, that he himself can pass the catheter and clear the urine, that is clean intermittent self catheterization, that can also be practiced.
Right. And I would also like to know, as our viewer had already asked about the, elderly people's problem. Now, apart from this particular issue of urinary incontinence, there are other things as well. Many a times they are not being able to hold. Of course, this is a problem. Then they have enormous issues. Hygiene is an issue, and people suffer from UTI, but then they are not being able to tell that they have these problems. When patients come to you, such patients, elderly patients come to you, what do you advise, or what do you think that they should, they have missed, they should have noticed this earlier and came to you much before?
Yeah. Actually, see, in old patients, there is if we talk about the females, if they have given childbirth, multipara is there, then they lose the urethral support. Then that could also be the cause of urinary incontinence, which is known as stress urinary incontinence. Suppose a female coughs or suddenly lifts something or laughs aloud, there is leakage of urine. So we have to, via medications, we need to treat it. If it is not getting relieved by medication, then we have to do some surgeries like transobturator tape or transvaginal tape to give support to the urethra. If there is cystocele or rectocele or prolapse of uterus, we need to take care of that. That can all result in urinary incontinence. In the male, it is the enlarged prostate or say narrowing of the urethral passage that can result in urinary incontinence. And as I said, the stroke patients, neurogenic bladder. So we need to take care of person. We need to have a personalized approach to look for what is the cause and enlighten the patient, the older guys and their relatives. Besides tender love care, we need to have a personalized attention and take them in confidence that these things are treatable. They should visit the right doctor.
Right.
Because in our country there are multiple people who are doing medical practice, so that is also very important. that they should reach the right doctor, particularly the urologist for these problems.
Right. It's very important to go to the right person. In this case, you need to go and consult a urologist. Doctor, many a times it happens that, as we have already discussed, that people tend to ignore the fact that they are facing some kind of problem. Before I take my question, there is a viewer called Suraj Kamal asking, when did you first notice your symptoms? I think he's trying to ask that what to do when we first experience those symptoms.
Yeah, the foremost symptoms, as I earlier told, is the burning in during passing urine, a smell in urine, color change of urine, frothy urine, and see if things like that. Yeah, and swelling in the limbs. These are all suggestive of UTI. Most
Oh.
important is burning sensation, change of the
Mhm.
color of the urine, and bad smell in urine.
Okay. Are children's kids equally at risk for UTIs? Because many a times it happens that they, have fever all the time, and after a very long time, it get diagnosed that they are actually suffering from UTI.
Yeah. Small kids are also at very much risk of having UTI. The kids who are wearing diapers. So the suppose urine is there, and if they are wearing it for a long time, they are equally at risk of getting the UTI. Again, here the female child is more at risk due to shorter urethra. And kids
Mhm.
who are having some anatomical disorders like posterior urethral wall or vesico-ureteric reflux, these group of patients are also, these are the diseases of infants and children. These are also at risk of UTI.
Now, children may not be able to, sense or even tell that they are facing such problems or what's the symptom. I mean, it's really hard for a kid to tell. In that case, what the parent or the guardian should do.
Yeah. Suppose a child, whenever he goes to pass urine, he is holding his private parts and crying, both equally. And whenever he's not feeling well, when you ask him to go to bathroom, he is reluctant to do so. So these are the subtle indicators that the child is having some problems with urination, and medical help is needed.
Okay,
Besides having fever.
right. We'll also pick another question. The viewer is Anshul Dubey asking, Sir, how much urine does the average adult pass each day? Is there any measurement for that?
Well, a normal healthy adult individual passes, say, about 2.5 liters, 2 to 2.5 liters per day.
Mhm. Okay.
And if a person is passing more urine, then he could be suffering from diabetes insipidus, in which patients may pass up to 4 to 5 liters of urine also. A normal healthy adult, the amount varies from 2 to 2.5 liters.
Okay, fair enough. Vyapi Sharma is asking, what's the different species of bacteria that can cause UTI, and does the severity of UTI depends on the species of bacteria that infect the patient?
Yeah, very good and scientific question. Most common, the UTI is caused by bacteria, namely E. coli. It is the most common causative agent, Escherichia coli, followed by Klebsiella, Proteus. And in immunocompromised and diabetics, sometimes it is fungal infection also. So if there is fungal infection, the severity is more. E. coli UTI normally gets treated by a simple course of antibiotics. Normally, fungal infection is caused in immunocompromised and diabetics. So yeah, a species, there is a correlation between severity and the causative agent, which species is causing it. But we have now, at present, we have good antibiotics for all causative agents. And the most important is to find the causative agent through urine culture sensitivity. And if we give the right treatment, right antibiotic, then it is treatable.
Right. Doctor, you have already told us about how can we prevent having UTI. Now, suppose I have all the symptoms, but still I'm in the mode of prevention. I don't want to go and consult a neurologist. I will try and, take a lot of fluid. I'll try and take a lot of cranberry juice and lemon water and whatever. Try to maintain a healthy lifestyle. Is there a possibility that without consulting a doctor, taking medical help, I can take care of myself and my UTI?
Yeah, if you follow all these measures and there is no anatomical disorder or neurogenic abnormality, then there are very, very less chances of yourself getting a UTI. So it's like that if you are daily doing cardiac activity, cardio exercises, you are fit, you are maintaining a regular lifestyle, no smoking, no alcohol, then what is the risk of heart attack? So it's like that only. So the chances are very less if you follow these healthy lifestyle measures. Yeah.
But suppose I started having all these healthy lifestyles only after I experienced all those symptoms which are, responsible for UTI. Before I was not doing anything, but then I see those symptoms, do some Googling, YouTubing, and then start, taking care of myself through these things only. Can it be dangerous?
Yes, it can be dangerous because if we don't treat the infection, then it will slowly increase. So first and foremost is to treat the infection and then follow these healthy lifestyles during the course of infection also, so that it does not recur.
Right.
That is, yeah.
Amit Singh is asking, can we flush out a UTI with water?
Yeah, the basic concept of taking plenty of fluid is flushing out of the bacteria via urine. So if you take more amount of water, the adequate amount of water, the appropriate quantity of urine is produced, which needs to flush out the bacteria. Basic concept is that only, that if you take plenty of water, bacteria don't get a chance to grow. But since when you have UTI is diagnosed only when you have ample amount of bacteria in urine, so for that we need, besides ample amount of water to flush the bacteria, antibiotic also to kill them then and there itself. Yeah.
Okay.
So they don't overgrow and make a colony for themselves inside the urinary tract. Yeah.
Fair enough. Astha Dubey is asking, what is the best antibiotic for urinary tract infection? I don't think antibiotics are there for, people to self.
Actually,
just go and buy it.
Yes. Actually, this self-medication should be discouraged, and there is no one particular antibiotic that you can take every time. It depends upon the agents which is causing it, the causative agent. It differs from person to person. Yeah.
Yeah, so it's important, Astha, that whatever problem is there, it should first get diagnosed, and only a urologist or an expert can do it. So please, if you are facing any of these symptoms causes inconvenience, please go and consult your doctor. Don't try to take antibiotics or anything over the counter. It is going to harm you more. So please.
Self-medication can be dangerous. Yeah.
Right. Radha Sharma is asking, good evening, doctor. What fruit is good for UTI?
Yeah, good question. As I already told you, the best fruit for this is fruits containing citric acid and vitamin C, like lemon is there, cranberry is there, mosami is there, or any fruits which has good water content, like this thing, watermelon is there. So basically, the main fruits which decreases the incidence of UTI is cranberry and lemon.
Okay. Amrit Singh is asking, is vitamin C good for UTI? I think you have already answered his question. Yes, vitamin C. Yes. Raj Sharma is asking, we have addressed it, but still, what to do to avoid having a UTI?
Basic, maintain a good lifestyle, have good sexual practices, and take plenty of water. Avoid constipation, avoid high blood sugars, and if you encounter or suspect that you are having a UTI, meet the urologist as soon as possible.
Right. Doctor, how dangerous can UTI be? What can it lead to?
Yeah, neglected UTI can cause permanent damage to kidneys, one or both. So it could be very dangerous. Suppose a immunocompromised person is there and he neglects his symptoms. There could be fulminant renal abscess, which could lead the kidneys to non-functioning status, and we have to remove the kidneys. He could be permanently on dialysis. But these are very rare situations. And suppose if a person is there who is neglecting his initial symptoms, then he may need to get hospitalized. catheter needs to be placed, he should be on IV antibiotics. That could be a cause huge symptoms, a huge burden on his pocket, and things which could have been easily controlled needs more time, money, and concern to the family members.
Right. And does, when patients come to you, what do you advise them at the very first stage? What's your first, thing that you tell them to do or
Yeah,
practice?
the first and foremost, I tell them that they should indulge in the various healthy lifestyles, increase their fluid content, inculcate fresh fruits in their dietary habits, have lemon, cranberry if possible, and if they are diagnosed with this thing, I personally suggest to plenty of young people to get these urine examinations and various labs. Yeah, and tell them to follow up after a few days.
Yes, yes. Vikas Sharma is asking, what is the main cause of UTI in females?
The main cause of UTI in females, as I earlier told, is they are having shorter urethra. So it is easier for bacteria to reach the bladder. Suppose a bacteria to cause UTI needs to reach the bladder. In males, it is a distance of say 20 centimeters. In female, it is hardly 4 to 5 centimeters. That is the main cause, the anatomical cause.
Okay.
Bacteria needs a less distance to travel from outside, from infective environment to the bladder to cause UTI in females. Hence, they are more at the risk. Yeah.
Right. So definitely a female is more at risk. So please take good care of yourself. Take care of your hygiene as well. Many times it happens, doctor, because women go through menstruation. They use sanitary pads for, a longer time. And again, as you have already said, that if we do not maintain a particular level of hygiene, then of course UTI may occur. So in those 4 or 5 days of menstruation, again, women need to be very careful. It may cause
Yeah,
irritation
yeah,
or
yeah.
UTI.
Yes, yes, yes. As you rightly said, the sanitary pad should be regularly changed, and level of hygiene should be a bit higher on those days. And one most important thing is that they should clean from front to back, not from back to front, because in the back more bacteria are there. One of the most important thing is that while cleaning, they should clean from front to back rather than from back to front. That is also one of the most common and easily could be easily practiced and often ignored thing. Yeah.
Right. So it's a very small thing. You just need to practice it. I mean, in a
Yes.
day
Yes.
and two, and it will become habit.
Yeah.
Thing.
Yeah.
Just go from front to back and not the other way around. Otherwise, you have more
Yes.
chances of catching
Yeah. Yeah.
infection. Right. We have Amrit Vibhushan asking, can a UTI go away on its own?
Uh, yeah, if it can go, if it is a simple infection is there, there is no anatomical cause causing it. If you increase your fluid intake and drink plenty of plenty of water, avoid constipation, take some citric acid, lime water, it can go away. If it is a simple UTI, but if it is a complicated UTI, then it may need medications.
Okay. Raju Iyer is asking, should I be worried if I have an UTI?
Yes, why not? If you are having infection, it needs to be treated and taken care of. If earlier you intervene, your worry will finish earlier. Otherwise, they may prolong. Yes, you have to take prompt action.
Yeah, I think the most important thing is not to ignore your,
Yeah, yeah.
symptoms. If you are facing any of those symptoms that doctor has already mentioned, and as he said that if those, burning sensation, etc., if it's going away in a day or two, it's okay. But if it's there, please go. Don't waste time and I'll just wait and watch, and maybe it will just go by myself. Don't wait and watch. Just go and consult your doctor, because if you waste time here, maybe it will take a lot of time at the doctors or the medical front to treat your problem. So be prompt about your problem and go and consult your doctor. Ishita Jha is asking, are bananas good for urinary tract infection? Doctor, you have already mentioned lemon and cranberry.
Uh, Actually, bananas don't have a specific role in this regard, and constipation needs to be avoided. So, if people who are having who get this constipation, they feel better with banana, then yeah, in it may indirectly help in preventing UTI, but as a direct causative agent, it does not have a significant role.
Right. So if you have the problem of constipation, then banana will help you out. And then because constipation may lead to UTI, that way it may save you from UTI, but no direct connection of banana and UTI.
Yeah. Yes.
Rahul Das is asking, how do I know if a UTI has spread to my kidneys?
If UTI has spread to kidneys, you will be having fever, chills, rigor, flank pain, and you will be more symptomatic. And it will be the pain and the uneasiness will be throughout. And if it is localized, that is limited to lower part, then at the time of passing or urine, your symptoms will be aggravated. So if you are having high grade fever, chills, rigor, flank pain, then it is a direct indicated that it might have spread to kidneys, and it is urgent need to see the urologist and get radiological investigations to confirm it.
That means the patient has already wasted a lot of time in ignoring the issue, and that's why it has spread into
Yeah, yeah,
his or her
yes.
kidneys. And how bad is that? Spreading UTI in kidneys. How bad is
Yeah,
that?
yes. Most of the time, if it is known as pyelonephritis in technical terms, patients needs to be hospitalized. IV antibiotics, intravenous antibiotic course is given, say for 5 to 7 days. Response is seen, and sometimes if the situation is worse, it has caused pus collection in the kidneys. That is, or air collection in the kidneys. Like it is known as emphysematous pyelonephritis. Then we need to do some surgical procedures also, like placing in the stent or draining the purulent fluid or infected urine via percutaneous tube. So it's means it's not a good thing to have, and that's why it's very important to have a early treatment and take care of the symptoms.
Right. So it's important to, take care or address your symptoms as soon as they occur to you. Please go and consult your doctor, but at the same time, don't panic. Can panic be really bad in such cases, doctor? Because the thing is, nowadays, it's so easy to Google anything, to find a lot of information that's there on the internet. So can panicking be bad, and rather than panicking we should
Yeah,
first try
actually,
to
it
address it.
applies to everything. It applies to everything in life that half knowledge is dangerous. Whether you go to buy a car, or dress, or house, or something. So by Google or by internet, I think most of the time we get the half knowledge. So it's very important to seek the experts and get the right knowledge, have a full knowledge, and by panicking, you are doing no good. So you should be confident and be calm and collected. Now treatment is available for most of the things, and the only thing is that you need to go to the right person, which I think if you are calm and collected, you will ask some friends, and you may land up with some nearby urologist and who will treat your causes. And if additional some things needs to be done, he will guide you. So never to panic and don't believe in what internet is saying. Because if you Google in internet that harms of drinking water, then also there will be a list of 10 things which will come that drinking water can cause what. So yeah, yeah.
And it depends. Everyone is different. Every individual is different. So your problem may be different from others. So please go
Very
and
true.
consult
Very
the
true.
right person.
Yes, yes,
Right.
yes.
Doctor, any concluding thing, concluding note, or anything that you would like to say to our viewers as we are, at the concluding part of this session?
Yeah, it was a very nice interactive session, and you have touched all important points. And the program like this can create awareness in society and will lead to towards better health, overall health of society and public in general. I will just want to say that you should not ignore your symptoms. The most important is the earlier you interact, the earlier you intervene, more easier it is to solve the problem. So the basic mantra of healthy urinary system and healthy lifestyle is to have a plenty of fluids, maintain a good dietary habits, avoid junk foods, avoid constipation, have a regular health checkup at least once in a year to know whether you are having some subtle problems of increased blood sugars. Yeah, that's it.
Right. So stay healthy, and to stay healthy, you need to do all good things like stay active, physically active, stay clean, take care of your hygiene, keep yourself hydrated, eat good, sleep well. And if you have a problem, especially if you have any urinary related problem, do consult a good urologist. Thank you so very much, Dr. Suresh Singh, for your valuable time, sir. It has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times. Thank you so very much.
Thank you. Thank you. Thanks a lot. It was very nice interacting with you. Thank you.
Thank you. And we would also like to thank our viewers for an excellent participation. So for more informations and updates on UTI, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Insta. Thank you and good day to all of you. Goodbye.
Thank you. Thanks a lot.